So we'll be recording this webinar today, and then it'll be available online for people who want to review it afterwards. So again, this is an educational informational talk. There will be some interaction involved. I don't want people to reveal any personal health information, please. But there will be, the questions are geared so that personal health information need not be revealed. It'll be more of the evocative of emotional aspects. This is not a diagnostic talk, and this is not a substitute for talking to your doctor. If there are any questions about this afterwards, please let me know, and then we can take some time to figure out next steps. Okay. All right. So who am I? So my name is Rakesh Sarma. I'm currently an integrated integrated functional medicine specialist, but I have a different history in terms of how I got there. I grew up in South Georgia. I went to Duke. I studied English and religion. I then decided to do medical school in 2003. Wasn't very satisfied with the whole conventional medical process. I finished my internal medicine residency, was a hospital physician for several years, and was also a primary care doctor for about the last 15 years or so. I completed my fellowship in integrative medicine. For those folks who don't know what that is, the idea behind integrative medicine is that you combine conventional and holistic modalities so that you get the best possible outcome for people. I learned very early on in my medical career that people were taking other things, supplements or herbals and so on and so forth, as a means to improve their health, and I didn't have enough of an explanation for it. And I also recognized enough that people, from an allopathic perspective, when they were getting medicines, it just wasn't enough for what they were looking for, and especially when we're talking about the depression and anxiety spectrum. So I've worked as a hospital physician, I've worked in a psych hospital, and again, as primary care, and now I own a practice in Sandy Springs. So with COVID, what we're seeing is definitely an increase in depression and anxiety, and I've seen it even in clinicians, healthcare workers. I think part of it is the social isolation that's happening, the imposition of rules, the differing of opinions, you name it. There's any number of factors that's creating a social maelstrom where people feel have different reactions to the events that are unfolding in front of us. So what exactly is depression and anxiety? This may seem like a silly question, or even an obvious one, but I'd like to ask you, what words do you use to describe depression and anxiety? And
depression.
What was that?
Depression.
Depression, okay. What does the word depression mean for you?
Being out of sorts.
Being out of sorts, okay, excellent.
Kind of sad or melancholy.
Okay, sad, melancholy. Yes, perfect. Sadness is a word that I use very commonly for depression. I like to keep things as simple as possible. We can all relate to the emotion of feeling sad. So with that, sometimes the word depression itself can be a little bit ethereal. I like to keep it a little bit more basic in terms of human experience. What about anxiety? What words do you have for that? And anyone can say. For me specifically, it's fear. The word fear correlates with anxiety in a very clear way for me. And anxiety could be a low level of fear. Fear could be terror. So there's all levels there. So does anybody else have any other words?
For me, it's stress and nervousness.
Thank you. Thank you.
Confusion.
Confusion. Okay, excellent. Confusion can be another level of anxiety. Directions, choosing a direction when there's so many options involved, that can provoke anxiety as well. Exactly. So, and if I can have you mute again, thank you.
Sorry.
Oh, no problem. No problem. All right. So the conventional approach to anxiety and depression comes in the way of the history and physical exam. As I said, I was primary care for several years, so I would often just ask people, but the number of questions that I had in my armamentarium were very low compared to what I learned over the course of other modalities. So the history will look at the immediate time frame. A practitioner may or may not look at whatever caused the event, what caused the depression, what caused the anxiety. In some situations, you can find a biochemical equivalent to it, but even in the conventional medical world, sometimes you don't see as much of an in-depth investigation as I've learned is possible by looking at other modalities. Sometimes they may give a medication, they'll suggest something like or a cognitive behavioral therapy. So there's different approaches. Pharmacology. So many people probably know, or many people are already on a medication. I'm not asking if you are or not. The whole point of pharmacology is the idea and the recognition that certain neurotransmitters in the brain are, and throughout the body, are a little bit off. And so you're giving a medication to sort of readjust those neurotransmitters. So for example, the serotonin system or the norepinephrine system. I'm not going to get into the heavy details of that, but just recognizing that those systems could be off balance on a biochemical level means that pharmacy is targeting getting those systems back in balance the way it knows how to do. The problem is a lot of those medications throw other things off balance and then they create side effects. Some people can have like constipation. Some people can have like fatigue even. Some people can even have worsening of their depressions or even some suicidal behaviors. You've seen plenty of commercials on TV that say, if you have this medicine, be aware that it may cause this, this, and this. And there's any number of biochemical reasons that create that effect. Same can be said for anxiety. A lot of there's a very interesting overlap in terms of depression and anxiety in terms of the medications that we use. And one of the most interesting things I noticed when I was doing this talk and setting up this PowerPoint presentation was that a lot of the facial expressions that people were going through with anxiety were like the same as depression, like this, or like this. And so I found that to be fascinating. And at the same time, there's an overlap of medications. There are also some other medications that don't overlap. For example, like the Xanaxes and the benzodiazepines. Those though can be addictive, and that's where you want to be a little bit careful with that use. So a polling question. Let's get this started here. Give me 1 second. There we go. So I'd like you to answer this question. Is depression and anxiety all in your head? Are y'all able to see the question? Okay, I think.
I'm gonna step out on a limb and I'm gonna say yes.
Okay, thank you. And if you are able to answer the question as the poll comes up, you can. If not, if it's not coming up for any reason, you're more than welcome to just answer out loud. So that helps.
No.
Okay. Okay, very good. Very good. So we got a couple of yeses, we got a couple of no's, we got a bit of both, and I'll stop the poll there. All right, so I'm going to share those results to you. All right, so I find this question to be extremely important because people are recognizing that depression is not just about a mental aspect. So, and I think the problem with the whole phrase all in your head is there's a judgmentality involved about having some sort of negative state that's taking over, like a depressive symptom or an anxiety symptom. And on the societal level, there's still some of that stigma that's associated with having a mental health issue. So part of removing the idea that it's in your head is to address that societal stigma and say, no, not the case. And how do you find the conventional approach of depression and anxiety? Let's see if I can move that. Let's try that. Do you find it useful? Do you find it effective? Do you find it not very effective at all? Are you neutral about it? So if you can answer those questions, somewhat effective. Excellent. Somewhat ineffective. Okay, getting that. So somewhat effective, a good number of folks. Excellent. So people are recognizing then that the pharmaceutical component can be useful. I'm glad about that. That's why I approach things from an integrative perspective. I had someone a couple of weeks ago who I was seeing in my clinic. And really the thing that worked the best in that particular time was the pharmaceutical approach, because for whatever reason, the biochemistry internally had gotten to the point where the pharmacy was necessary to decrease some of the symptoms. And that's okay. I tell people we're looking at things in terms of a spectrum. We're not looking at things in a cut and dried sense. And there are many ways to approach it. Okay, so I'm going to stop that poll there. I'll share that. Just so you can see. Good. All right. So what is an integrative approach? The real question of the integrative approach that I found is, what exactly are we trying to integrate? I like using a multiple step approach because I find that there's so many ways to actually get to it that are in addition to or beyond the medication. So it just really depends on the person and their situation. If you haven't looked at your diet, if you haven't looked at a deeper look at your biochemistries, if you haven't used certain supplements that could be helpful, if you've never had someone say what values are conflicting within yourself, and taking a deep look in terms of like what you're most oriented towards and how they may actually have some overlaps which get in the way of each other and create inner friction. And if you haven't had someone talk to you about self-centering practices or spirituality, I recommend that more than everything, because the whole approach is about integrating you as the person. So a depression may be a biochemical issue, but there's a reason, for example, cognitive behavioral therapy, which is not necessarily just about medication, has such great effect in improving symptoms. So it's using another approach. So it's not all just in the biochemistry. And like we all mentioned, it's just not all in your head. So how many of you think that how and what you eat may affect your moods? So let's do one more. All right, another poll. I got a strong yes on one of them. Oh, 4 out of 4 so far. 5 out of 5. Okay. So there's good awareness here. I'm very happy to see this. I'm very happy to see this. So I think I'm going to go ahead and stop the poll. So we're already at 100%. I think you guys have gotten that one down. So one of the things I find is different foods affect different people in different ways. A lot of times I look at folks and I say, what are your favorite foods? Can you stop them for a couple of days and see what happens? And I really mean that. A lot of times we eat foods based on comfort. A lot of times we eat foods based on boredom, or fear. So a lot of times we're eating the same foods that are creating the same effect that we're trying to avoid, even if at the moment they're not doing that. Downstream, they may be doing that. So macronutrients. So macronutrients basically are like your proteins, fats, and carbohydrates. Everyone is familiar with carbohydrates, so we'll spend more time on that one. So carbohydrates, for example, it's been shown that having more carbohydrates in your diet can shift your moods like this up and down. So if you're finding that your moods are going up and down very rapidly in the course of a day, it may just be because you have too many carbohydrates on board. And something as simple as shifting the percentage of how much you're eating may keep your moods more in a balanced state. So doing something, so one of the things I emphasize more than anything is the volitional aspect of your own state of emotions and whatever you can do for yourself. And so if affecting your macronutrient imbalance by just saying, you know what, I'm going to cut down some of these carbs, you may find a mood may shift right then and there. We've all heard of gluten-free. And so I always ask people, do you eat a lot of gluten? Is it something that you can stop a little bit of? Gluten has been associated with a lot of depression, has been a lot associated with anxiety. So I've read so many different things about this. I've read that the gluten content in wheat now is higher than it used to be. I've also heard that the gluten content is not higher than it used to be, and it's more the gliadin content. The whole point of the matter is, and I emphasize this repeatedly, the why of something that may be affecting you is not as important as is it affecting you. If you can see for yourself when you eat something and you have, for example, bread with a bunch of gluten in it, and later on you feel a little duller, a little bit heavier, a little bit more inflamed, a little bit more achy, a little bit more painful. All of those factors are going to play into what your mood is going to be. So this is where it becomes an experiential process. Everybody said foods, you know what foods affect you. So if you know how that's going to affect you potentially, or if you haven't paid enough attention to exactly what the food is that's going to affect you in that way, I emphasize again and again and again, please pay attention to that, because that's something you have in your hand that you can avoid doing for yourself. So again, take off gluten for about maybe a week, 3 weeks or so, see what happens to your system. If you feel lighter, if you feel less painful, if you feel your mood has improved, you may find your answer right then and there, and there's no other reason to see anybody. Actually, before I go there, my wife and I, we were in a Big Lots a couple of months back. I think it was actually about a year ago. And we saw this lady who was, I think she said she was in her 60s, and she had some rheumatologic issues. And so we were waiting in line, we just happened to be talking, and she said to us, you know what, I stopped gluten and my joint pains went away, my mood improved. So these are the kind of things which I didn't even see this person in clinic. It's just a very simple anecdote, which is important in terms of impressing that even one person can just say, you know what, take this out of the diet, see what happens. So, and then what do some of these foods do for your mood? You know, we're all familiar with the good foods, so I'm not going to go into a laundry list of what are the most recommended foods. There are diets that are tailored, and the integrative functional approach does tailor those diets based on a person's condition. But generally speaking, I say if you have a positive effect physically and emotionally after eating a certain food, not just the immediate comfort level of the food, but the physical effect. You feel lighter, you feel a lot less heavy, a lot less dull. Your mood is a little bit lighter. Again, those are the foods that I'm going to emphasize. Generally speaking, I always talk about the anti-inflammatory diet, and there's different principles in that. The Mediterranean diet can be fantastic for reversing people's chronic conditions, including depression and anxiety. I always bring in a little bit of the pain and inflammation element when I talk about depression and anxiety, because there's such a connection between inflammation and depression. There's such a connection between inflammation and anxiety. So when I mention the anti-inflammatory diet, I always mention a story I had with somebody who was training with me. His mom, he was a ICU doctor, pediatric ICU doctor, and his mom had steroid-dependent lupus, which meant she was on steroids for potentially the rest of her life. So, and obviously her moods were not great because of it, because steroids can also affect moods. So the moment he put her on an anti-inflammatory diet, not the moment, he said about 6 months later, she wound up being off of steroids. So those are the kinds of stories where diet as medicine, food as medicine becomes a practical thing that can be extremely important for what you can do for yourself to get out of either negative emotional states or also negative physical states. So let's shift topics just a hair. Do you think that supplements and herbals can be useful in managing mental health? And I'm going to put that up in just a sec. There you go. So I'm seeing a lot of yeses. So some of these questions, I'm glad that people are answering in that particular direction. So, okay. Let me go ahead and move this off. All right. So vitamins and micronutrients. Vitamins and micronutrients. This is a talk in and of itself, and there's even talks and more talks about just one vitamin in general. One of the hardest things I found in coming up with this talk is I was presenting such a broad view of so many different aspects that even I was looking at it going, I can see how easy it is to get lost in this. Vitamin D, you probably have all heard of in terms of mood and depression. For example, how many people feel like they're out in the sun enough, especially today? Either answer out loud. If not, I was giving a senior talk yesterday at a senior retirement home, and they were all saying, no, we're not out in the sun at all. So vitamin D, for example, is a sunshine vitamin. It is activated when we're outside. But the reality is we're not now outside as much as we could be in the past. And vitamin D has been linked to depression and anxiety. So that's another one that I like to check for and make sure people are low or higher on and have enough of. B vitamins. B vitamins contribute to low energy if you don't have enough, B12 especially. Zinc and copper have been shown, the ratio of that relationship in the brain has been linked to depression and anxiety. Magnesium, when that's low, can be linked to anxiety. Iron, selenium, there's so many others. So from a mineral support perspective, this is some of the things I look for, is if people are buying lots of different vitamins or supplements and so on and so forth, I say you might want to look and see if you've had those tested. Too much of a good thing cannot necessarily be a good thing. And if you don't have enough of a thing, it's obviously going to show up. And the polls have answered that question. So, additionally, essential fatty acids. If you don't have enough omega-3s, if there's an omega-3 imbalance, that can lead to depression and anxiety. If you have so much inflammation, you don't have enough antioxidants in your diet, that can easily contribute to a negative mood. Herbals can be fantastic. We'll get on that a little bit more in just a bit. Probiotics, we'll also get on that in a little bit. So herbals like ashwagandha, for example, you may have heard of. It's actually, when I go to Costco now, I see it everywhere. It's a great adaptogenic herb. Adaptogenic herbs mean they help modulate the hormonal system. Turmeric, for example, some people pronounce it turmeric, some people pronounce it turmeric. Good for anti-inflammation, can also help mood if there's too much inflammation going on. Neem is great as an antioxidant, as a great detoxifier. So if you notice, again, I'm spending a lot of time looking at the inflammation aspect, and I know this is a talk about depression and anxiety, but if there's so much inflammation going on that is not being addressed, people's mood's going to stay off no matter what you give them. So I spend a lot of time saying, again, how are we going to control the inflammation in your diet? So then we start talking about lab analysis. So there's so many different ways to look at this. And I think probably the best approach is when you take a deep history of someone, you get some certain overlap in certain types of symptoms, and you kind of know what you're looking for when you're ordering labs, so what kind of labs you need. The standard labs are looking at like liver and kidney function, sometimes the thyroid, sometimes the B vitamins and the D vitamins. But then there's also looking at the magnesium level, again, the copper and the zinc that we talked about, looking at omega-3s. Is there too much omega-3s or too little omega-3s? There's gene testing. We'll get into that in just a little bit. There's inflammatory markers. If you've never been tested for a general level of inflammation in your body, it's very useful to do, because then you get an idea for yourself if there are certain action steps that you can take in terms of diet or supplements to reduce that. Gut health is key. This is something I didn't realize this until my teachers in the functional medicine training harped on it repeatedly. Even if people have a normal gut function, there's an assumption that everything is okay with the gut, but testing the gut may actually reveal some of the causes of depression and anxiety, in addition to so many other things. Because there may also be a lack of nutritional absorption, which is another form of testing. Let's get to that part. So if you can eat the best foods in the world, but if there's a problem in terms of how much of the nutrients that you're taking in is getting into your system to achieve optimal function, then you can, again, be on the best diet in the world, but there's a problem in terms of what the gut is doing to get the food in your system. And that's the whole point of this slide. This person, for example, I don't know if you can see the mouse here, has an omega-3 imbalance. And so based on these scores here, you can see that even though other parts of the gut function look good, the 7 shows that their omegas are off. And so then it's a matter of just improving their omega-3 statuses, because that will also help their inflammation and then secondarily help their depression. Thyroid. This person who I saw recently, not recently, about a year ago, the thyroid panel looked great. It looked like, in the conventional world, this is essentially all I would check, which is the thyroid TSH level. If you don't know much about thyroid helps your metabolism. It helps energy. It helps so many different factors. When it's low, a lot of times people can be depressed. When it's high, people can be extremely anxious. So even when the labs look like they're totally normal based on conventional evaluation, the best part that I've learned about the functional medicine approach is there's a lot more complexity to it. In this person's case, for example, the reverse T3 was high. So what does that mean? That means their stress level was high. Their cortisol level was high. Cortisol does this interesting thing with the thyroid where it actually shifts the best functioning part of the thyroid into a secondary state. So the body recognizes it's in stress. So it's trying to go into kind of a more of a defensive state. And so that's where the optimal function of the thyroid is actually not happening, even though the labs look like it. In this person's case, giving a bit of selenium can help reverse the reverse T3. And also some stress reduction exercises could be useful to help them achieve a better thyroid function and also a better mood because of that. So another person, which this is the adrenal gland. So looking at the adrenal gland can be extremely vital from a perspective of depression and anxiety. Low adrenal function can cause one form of depression, and too much adrenal function could cause a different form of depression. Melancholic, agitated depression is indicated in this case. So what this slide shows us, and I'll simplify it a little bit. This green area here means the normal cortisol function throughout the day. If at any point during the day it's off, then a mood is going to be affected because of that. In this person's case, when it starts moving into the red, they're going to get a little bit more agitated towards the afternoon. In the evening, they may feel a little bit more anxious because there's too much cortisol in the system. And it's tapering down, but not enough. It's still a little bit off. So all of that means mood shifting during the day. This could be a result of, like we talked about before, a heavy carbohydrate diet. And so shifting the diet, for example, now you have a snapshot of what the biochemistry is doing after a course of years of how the hormones have adapted. It could be just stressors. So all of these factors are in the same person, right? It's not happening independently. You're looking at several different snapshots of the same person and saying, okay, how are the hormones affected? How is the biochemistry affected? How are their moods affected? And so on and so forth. And there's some simple treatments for this. In this person's case, giving something like a phosphatidylserine could be useful. Ashwagandha was very helpful in reducing that person's anxiety. But having the lab testing to match the state it winds up being very important, because then you're not just playing guesswork. Okay. So let's get a little bit more deep. Let's talk about genetics for a second. So I'm not going to go too crazy in terms of the explanations of this, but very simply putting, some people's genetics have a tendency to lend more to a depressive state or an anxious state. In this case, this is still about cortisol. This thing here, NR3C1, when there's too many of those off, as in the case of this person, then it basically tells me they have more of a tendency towards depressive states, more depressive states. And so then I'm going to work on an herbal plan that helps the cortisol function, even though the genetics are off, to be more adaptive. So certain exercise programs can help. An Iyengar yoga, for example, could be very helpful for this particular individual, because it has been shown with this particular genetic trait to be helpful. So we'll get into more of that in a little bit when we talk about the movement section. But I wanted to just touch a little bit on the fact that ignoring genetics is not something that, let me rephrase. Paying attention to genetics becomes just as useful as a treatment modality. So, and it's not something you learn much about in conventional medicine. In fact, not at all. This is another one that's very commonly known, MTHFR. When you have a lot of the genetic SNPs, they're called SNPs, single nucleotide polymorphisms, which are a little bit off, then that can also lead to states of depression and anxiety. Then you want to tailor them to having more folate in their diet. a very simple explanation for this process, and it goes much, much deeper. There are lectures and lectures about this itself, but I just wanted to give a window into this is occurring in the same person all the time. This is the whole point of integrating the you. If you can look at different levels within a person and work at those different levels without overwhelming that person, you also have to see what are they capable of doing. And when we talk about the coaching aspect of this, we have to see what is someone actually going to be willing to do that is going to change, because they may be stuck in a state that they're not yet ready to get out of, though they don't even know it. There may be familial components involved and so on and so forth. But this is still working, again, at the genetic level all the way up. So finally, what's poop got to do with it, right? When I was creating this talk, I thought I would have some music in the background, like What's Love Got to Do with It by Tina Turner. And I was just like, well, for copyright issues, I wasn't sure if I wanted to do that. But what's poop got to do with it? So there was an interesting study that happened in October of 2020, which showed that when people were depressed, if you've heard of the microbiome, it's basically gut bacteria, the bacteria that are normally present in your gut. They took the bacteria from depressed people and they moved it into animals, and the animals showed signs of depression. So that is extremely interesting. That means the bacteria that is in our guts at any given time could potentially be creating a depressive state, or could be creating a positive state. For example, this one, and I'm just using this as an example, Lactobacillus plantarum. It increases certain biochemical levels of butyrate, which actually decreases brain inflammation. So this is the whole idea behind probiotics. It's not just to regulate your gut, but it's also to regulate brain chemistry. So, and there's multiple probiotics. So I'm not saying just go ahead and start taking a whole bunch of probiotics. That's not the point. Because again, this is targeted. There's not a general consensus yet on how to utilize this information. It's just we're starting to recognize that there's such a strong correlation between gut and brain. So just to look at this slide, I'm going to simplify this very, very easily. This is a bunch of probiotics here, and these are the neurotransmitters they affect. They affect the GABA system, the serotonin system. So we talked about pharmacy from earlier. Serotonin, Prozac, and Celexa, for example, they all work on the serotonin system. Dopamine, norepinephrine, glutamate, histamine, the list goes on. So this is just to see if there's so many ways to also affect the microbiome, whether it's in your dietary patterns, whether you're giving yourself prebiotics, which feed good bacteria, or whether you're actually giving yourself probiotics. So again, testing the poop, for example, winds up helping us figure out what may be the best for that person, especially if they already have underlying bowel issues, and how to affect the negative depressive and anxiety states. So I got this slide from my coach a couple of days back, and it was perfect because this is the total different way of doing it, but so vital. So in it, this slide is from Facebook. So who came up with it doesn't matter. Dopamine, the reward hormone, dopamine, the reward neurotransmitter. The reward aspect: complete a task, do a self-care activity, eat food, celebrate a little win. This means you can do those little things for yourself that shift your mood. When I give a talk, especially at the senior homes, I tell folks, whatever it is you can shift yourself out of, whether it's actually going out for a walk, playing with a baby, simple things that can shift your mood. I'm going to recommend those every step of the day, because those are your day-to-day life activities. The supplements and the herbals, the whole point, and medications, the point of those is just to enhance the capacity for your life activities so that you can devote more and more time into this. The serotonin aspect, look at this: running, sunshine, meditate. Whether it's, these are the basic things that I always emphasize with people, is like what brings you joy in your life can be the most important thing for you. It may not be what everybody expects out of you, but it may be the thing you need for yourself to do so you can shift yourself out of the state. So many times I find, and we're moving on to the coaching aspect, is people stay in depressed states because of certain expectations they have for themselves, or certain expectations others have for them. And so if something is like, I don't know if I can go outside just for a walk, I have this, and this to do. But if you're going to be more present in everything that you have to do because you went outside for a walk, I'm going to recommend you go out for a walk. I love this slide too. In many shamanic societies, if you came to a medicine person complaining of being disheartened, dispirited, or depressed, they would ask one of four questions. When did you stop dancing? When did you stop singing? When did you stop being enchanted by stories? When did you stop finding comfort in the sweet territory of silence? So we're moving into that aspect of the integrative talk. Other things you can do that are beyond just the biochemistry and the genetics and the so on and so forth. Physical activity and postural work. Physical disciplines like Tai Chi, for example. Tai Chi is extremely well known for creating balance in people. It not only creates physical balance, but it can create emotional, mental, and energetic balance. The same thing with Kriya and Hatha yogas, which are done in a very clear way. There's so many other modalities out there. These are two of my favorites. These are all about helping you align both your physicality with your emotionality. A lot of times people's postures will demonstrate exactly where they're at in terms of their moods. A little bit more curvedness in the spine, for example. Sometimes you might need help with that. That's where doing a postural therapy like a Feldenkrais or a craniosacral therapy, stuff that we can talk about if you don't know anything about it, stuff you can look up. Some of those things by themselves, if done consistently enough and over time with the right person, especially with the right people, that can help you shift out of those negative states. All right. So this is very true. Changing a postural identification can be the physical door into changing your moods and your biochemistries. So even though we have already introduced a whole lot of biochemistry and genetics, I don't want people to think that I'm just because I have this biochemical pattern or just because I have this genetic pattern, I'm stuck being how I am. I don't think that's true. I think everything shifts, everything changes over time and with the right ingredients. Energy adjustment modalities. Acupuncture, reflexology, aromatherapy. Talk to Roz Zollinger, one of my favorite people. She knows as much as there is to know about reflexology and aromatherapy. Or work on your own energy system. Again, it goes back to what you can do for yourself. So you can get the whole point of my emphasis is in what you do for yourself, what you do for yourself, what you do for yourself. I think too much of conventional medicine is oriented towards what we do to you or for you for your biochemistry. I will look at it from, yes, we can have that as well. There's no question that that's important and valid when it's valid, but it's just as important as valid, if not more so, that you have what you do for yourself. So again, the Tai Chi, the Qigong, the Kriya Yoga, you may not be ready for those. So you may need other modalities to help you get to that place where you are ready for those. Again, it is a spectrum. So doing it on your own versus being coached. Why is being coached important? I've had a coach since I was in residency, actually. So since about 2004. And what a coach does for me and why I use a coaching emphasis in terms of how I approach my patients. I'm my own coach in my practice. So it's about learning accountability. It's about finding any way possible to create motivation. It's about having a consistency. Someone's always there looking and saying, okay, are you doing this for yourself? I always tell folks, this is not about judgment. This is not about shame. This is not about guilt. This is not about expectations. What you choose for yourself is your choices. I can only say, is this choice creating usefulness for you, or is this choice creating harm for you? Especially in terms of depression and anxiety, it's very easy to have those choices that propagate it. And so when there's a tendency, for example, towards creating a choice over and over again, we all know this, that happens. Otherwise, we wouldn't have an industry in healthcare. We wouldn't have an industry in coaching. Then if we add shame, guilt, judgment about it, how is that actually going to help somebody? We're already a lot of times doing that to ourselves. So a coach's function then is basically to say, okay, let's bypass that. we know that those reactions exist. Why are we going to feed those reactions? Okay, now beyond those reactions, where's the person who's doing the work to get past them? So I use coaching with depression and anxiety with some of the modalities I've learned, which is somatic experiencing and the Enneagram, in addition to other things. One of the first things that I talk about the most is reactivity versus responsiveness. So what does reactivity have to do with depression or anxiety? I'll give you a story. This is a hard story, but it's a very useful and illustrative story. I was covering at a clinic one day, probably about 6 years ago. I saw a young lady who was getting a refill of Prozac. She'd been on Prozac for about, I think, 8 years or so, she said. I only saw her once, and it's not a clinic I worked at consistently. Unfortunately, she had lost a child, and she had lost her child traumatically. And so she had another child, but she said she had maintained being depressed for years. So when I say the word reaction, I don't mean it in a judgmental way. I mean it in terms of the reaction to that loss created a depressive state in her, which had stuck around for years and needed medication. Okay, we get it. So a reaction could be momentary, a reaction could be decades, right? So with this young lady, we came up with an idea where she would have a ceremony, and in the ceremony, she would write to the little one that she lost for every day in a journal. And that little one's birthday was coming actually about, I think, 5 or 6 months later. So she decided at that time that she would burn everything in the journal, take the ashes from the journal, and spread them around the graveside of the baby. And that was her way of letting go of all of that emotional stress, trauma, etc. So this is where she decided to take the reaction that she was having which was totally appropriate, and change it, to shift it into something else. Okay. So give me a second. Okay, great. So somatic experiencing. This is a trauma-based technique which I utilize with people. And to make it as simple as possible, people, when they're in a traumatic state, can go into fight, flight, or freeze. Sometimes people stay frozen for years, even decades, right? What we're trying to do then is sometimes even the introduction of a positive state for that person can be extremely difficult. So you got to create a safe space for that person. You got to say, okay, let's see what a positive state feels like. Can we at least feel a little drop of that state? Sometimes with the practitioner's help, you can get to that state where you're like, oh, this is what it feels like to actually feel good. Okay, fantastic. When I was first learning this technique, one of the most interesting things I saw was a patient who had fibromyalgia, and she had had it for many, many years. So during the technique, we were I had her look around the room, and I had her look at a door. And so she found where her pain was, and she found it in the pattern on her door. We stopped that. We looked away, and I said, well, where do you feel safe? And she looked around, she found the exact same pattern on the door, picked up the feeling of safety in her body, and realized in that instant that she had equated safety with pain. And that little epiphany helped her see for herself that that's how she had been orienting herself. It felt safe to be in pain. Something as simple as that and as profound as that can shift a person so much. I may be going past time, so whoever can stay with me, please stay with me. All right. The Enneagram. What is the Enneagram? For those who don't know what the Enneagram is, this is a modality which is 2,500 years old. It was used by the ancient Egyptians as a spiritual development tool in recognizing different aspects of reality. Today, we use it mostly as a personality assessment device. It's been, like I said, has been used throughout history. It's been used by esoteric Christians. It's been used by the Sufi tradition. It's been used by so many different traditions because it recognized that certain patterns of behavior are imprinted in terms of how we orient towards our life. So one of the ones that I like to use, so there's basically says that there's 9 different personality types, and each type can either go into growth or go into stress. And you can learn what kind of communication style works with them based on how they orient to. You can also determine like what are they associated with instinctually. Do they like to make sure that everything's taken care of around them, or are they more relational? Do they work best in the intensity and the relationality, or are they more of a social orientation? Why does this is important in terms of depression, anxiety, mental health? With the way I've seen it, it gives me a map that I can see where tendencies are potentially flowing. It gives me a pattern that I can help them work towards, which could be optimal for their growth. It could be a pattern that I can see, I can see where this kind of stressor could lead them potentially back into more depressive states. It's so precise. It is so elegant. It's as simple as recognizing, for example, a type 1 has a powerful inner critic criticizing themselves all the time. So much so that they externalize themselves and start criticizing everybody else. But they're always like 10 times more critical of themselves than they are outside, even though it may seem the opposite. This is kind of the person at some points, where they can be like, man, they criticize way too much. But they can also be incredibly hard workers. They can be incredibly righteous. They can teach. They're beautiful in where their growth patterns are, and also destructive in some ways in their negative patterns. The helper type is a type 2. I'm not going to go through every type, but I just want to give you a taste of it. The helper type is a beautiful soul who's giving, but sometimes giving so much so, too much so, to the point that they overgive themselves, and then that can lead them to depressive states. So you can see where something as simple as an orientation, if you can mirror that very well for someone, again, with the caveat, remove the judgment, remove the shame, remove the guilt. We're going to be doing an exercise where this is important, and I'm already setting the stage for that. Remove those when you participate in the exercise. That'll actually help you see each other a little bit better. So I know we've been talking a lot. How do you think, or how connected do you think personality is with the oh, sorry, I didn't realize I kept that on. All right. How connected do you think personality is with predisposition towards depression or anxiety? And the poll's up for whoever wants to answer it. I'll give it a few seconds because I know I've got to be mindful of time. We've got about 10 minutes. I know I'm moving a little bit. All right, somewhat connected. Okay, all right, I'm going to shift. Okay, excellent, good. I'm going to stop it right there. All right. And if anyone has to go, don't worry about it. Well, I understand from a time perspective. The webinar will be made available after. All right, so I'm doing a 1-minute silent exercise, and this is all it is, and I'll tell you the why of it after. So let's get into just this. The candle will go on as soon as the candle goes off. I'll start talking again. You know, when I thought about doing this exercise, I thought to myself, am I going to actually spend a whole minute saying nothing in front of people that's going to record a webinar? But here's the reason why. Silence or any other self-centering practice can give you the space between a negative state and you. Let that sink in. You can go from a negative or depressive state in an instant if you find that right space between you and that state. And I don't care what it takes for you to get there. That's obviously useful for you. I'm going to encourage that every step of the way. When I talk about self-centering practices, they could be anything. They can be prayer. They can be meditation. They can be journaling, like we talked about before. They can be gratitude journaling. They could be forgiveness. Hobbies, sports, doesn't matter. Painting, artwork, gardening, yoga, Tai Chi, like we talked about, Qigong. It could be Bible study. As long as it gets you to that place where you go to that, okay, no matter what is going on in the world, I'm here. I'm going to encourage that every step of the way, because no matter what the biochemistry is doing and the hormones are doing and so on and so forth, we're making an assumption that those control us. Well, where's the you that's controlling them? That part is what I'm going to emphasize. So this is where we start doing a little bit of breakout rooms. So hopefully I've set the stage for this with the talk so far. So breakout rooms are very simple. It's going to be 5 minutes total per person. Let's look at time here, see if we can do this. We may shorten it. I'm going to do it for about 5 minutes total. So if you guys can keep track of time, I'm going to split the rooms up. So the question is, it's going to be 5 minutes total instead of 5 minutes per person, just to keep honoring the time. And so I apologize for that. I've gone a little bit over. So this is the kind of questions that I ask people when I'm with them in person. And this is also the questions that I ask people in group settings when I do group exercises. So this is just one small slice of that sample. So the questions are, what helps you feel joyful and what helps you feel calm and peaceful? So I'm going to split you up into groups of 2. So if you don't mind sharing with your neighbor, if you need to write those down, I can, or I can type them in the box. All right, do you have any questions for me before I get started? And if you do, you can just put it in the chat box. Okay, looks like everybody's back. Sorry, you guys got an extra minute. I forgot that. I forgot that it adds an extra minute when I say close all breakout rooms. So hopefully that was good. Anyway, so how was it for you? And you know, when I've done this kind of exercise before, I've done about 15 minutes at a time where I'm the one answering the question, like 2 people are in front of me. And for example, for me, what helps me feel joyful is my family, my little one, my wife. My little one was born 6 weeks ago. So can't describe the joy of that. It's just an experience, right? What helps me feel calm? Honestly, I'm just thinking about it right in the moment. Just looking at her eyes, it's just like there's this presence in her that helps me remind myself of my own calmness. So those are the little things that they're affecting, yes, on the biochemical level, on the hormonal level. I may not be aware of that. I'm just in my calm. And so those are the kinds of things that I want to encourage in people all the time. So anyway, enough about my experiences. Does anyone have anything to add?
I'll say something. I found joy also with my family. I'm a relatively new grandmother, but also I teach. So and I teach different. I guess you could in the realm of spiritual practices, and I think I have joy in a way of helping other people understand their own spirituality. And that's been a real, that's a real joy for me. I realize I never thought about it before. And then with calmness, and Joe and I were in the same room together, The ocean, she mentioned the ocean. I love nature, but probably the ocean is my favorite place. And it's not just, it's not the sunbathing, it's the water, it's the waves, and it's the hearing the ocean. That just is very calming for me.
Thank you. Anyone else have something to say? I see one comment in the chat box. I'll attend to that in just a second.
Okay, I enjoy talking to Common, and because we both realize that we get joy from family, and of course that has been kind of minimized during COVID, and we both found joy in the ocean or water, period. It just seems to be so calming and so relaxing.
Sure.
Even like a shower, I didn't mention that to Common, but just being in the shower or bath, just something about water that really kind of rejuvenates you, refresh you. It really kind of awaken a lot of your creative juices. So there's a lot of calmness in water.
Thank you, Joe. Fantastic. Fantastic.
I apologize to my partner. I am not good at this. And so I finally found a place to write. And I don't know if my partner got to write or not, but family was my big one as well. I enjoy teaching. I teach card making, and I was a teacher for 40 years. So getting to teach rather than 5-year-olds, adults, I enjoy being with people, period. I enjoy helping friends. And I enjoy my Bible time, my meditation in the mornings.
Thank you. So I'm going to address the comment. When it's tough for things that when there's a difficulty in coming up with things that make us feel joyful, this goes back to something I said earlier, which was sometimes even finding that little drop of a positive state can be just a big thing. So it could be a memory from way back when. It could be the dog that licked your face a couple of weeks back, or a month back, or 2 years back. It could be the connection you had with somebody that created joy at the time, may have not created joy after that, but that connection. So first of all, it's recognizing that any experience can create joy if we let it. Easier said than done, but part of it is like looking at it very closely to see how it does. Not just experiences necessarily of family, but usually when I see someone who has a difficult time coming up with things that make me feel joyful, it's more of an in the moment conversation where we spend time looking at like, what are the smallest, tiniest things that you did feel a little bit positive about, and how can we slowly start enhancing that. So there is potentiality with that. It just takes a little bit of time. Okay. And sometimes, again, there's other methods. Sometimes we got to work on the biochemical aspects. Sometimes we got to work on the food aspects. Because if the body is, again, laden down with all that inflammation and the choices of foods and nutritional deprivation that can color the whole feeling, and sometimes we need to clear that out first before the clearness of the joy and the emotive aspects can come up. Okay, and we're almost done. The last slide is, or almost last slide. Again, goes back to, this is an integrative approach, right? It basically, it summed up what I just mentioned, summed up this point. It all comes back to you. All of these things are happening with us at any given time. We may have some awareness at some level of some of it, we may not. Again, not judgment or criticism, it's just recognizing awareness and how we can do what we can do to shift ourselves out of a negative state, and the number of ways we can do it. There are a number of ways to do it. It is possible. Okay, and then almost last slide. So first, you mentioned spirituality. I think spirituality is probably, I initially had a much longer slide. I was going to spend a lot more time with it, but then I realized that would actually be minimizing the import of it. So I just decided to put 2 simple lines. For some, overcoming depression and anxiety can be found in the arms of religious activity. Again, prayer, Bible study for some, Bhagavad Gita chanting for others. It doesn't matter. They find that balance for themselves there. For others, there are dedicated paths for those who seek, who want a deeper relationship with the divine, whatever that is. That could be in the esoteric Christian tradition, that could be in the Hindu yogic path, that can be in the Judaic Hasidic tradition. There's so many mystical traditions that look for a deeper truth because of the existential sorrows and fears that we can all face. So for those, when people want to have that conversation with me, I love those conversations. Those are just as important, I think, as talking about the biochemistry. Not putting things as better or worse, just important. Okay, so we're pretty much done. Please feel free to email and let me know if you want to have a longer conversation. We always give a free discovery call for 30 minutes for anyone who's interested. Anyone who's attending the webinar will get a 10% discount towards their program or to visits if you decide to. Either way, with a free discovery call, if we feel like it's not going to, you'll find somebody else. I can help you find someone who may be better for you for what you need right now. And there will be a short survey after the webinar if you don't mind filling that out. That's pretty much it for me. Do you have any other quick, if you want to stick around for some quick questions, we can do that. And other than that, I'll go ahead and start the. Do you guys have any questions for me?
Yeah.
All right. Actually, I think the survey will come after. Yes. Okay. Give me 1 second.
Thank you so much.
No problem. No problem. I'm just typing to one person.
Thank you. The class was very good, very informative.
Good. I'm glad. As long as it was useful, that's all that matters. You keep well, okay? Everybody, I'm going to stop the share. Thank you for watching the webinar. Please visit www.sarmaintegrativemedicine.com to find out more about our programs that we offer, including our Beyond the Conventional program, as well as our Beyond the Functional program. Webinar participants and people who have watched this webinar will get a 10% discount. Please reference it during the conversation with Dr. Sarma. Simply contact us at info@sarmaintegrativemedicine.com. That's info, info at SARMA integrative, integrative medicine.com. Alternatively, you can call us at 404-474-1262, and someone will be happy to take down your information so that we can set up a discovery call. Thank you very much, and we look forward to hearing from you.